Hello, my name is Tamika Hobson, and this is my Nursing 444 Community Health Project on hospice versus palliative care. I'm a nursing student at Indiana State University, and the population at risk that this PowerPoint presentation is targeting is basically any chronically, seriously, or terminally ill patient who could benefit from palliative and hospice care services. I ask that you pause this presentation at this time, and in the description box below you will find a pre and post test. It is basically a test to assess your knowledge of hospice and palliative care, and you will take this before the presentation, and then at the end you'll be prompted to take it again to assess how much knowledge you got from this presentation. Please pause the video at this time. Now that you've taken the pretest, the objectives of this video, after watching, you should be able to compare palliative care and hospice services. You should be able to identify services provided for palliative care and hospice patients. You should be able to give examples of facilities where hospice and palliative care services can be received. You should be able to report the purpose of palliative care and hospice and summarize advanced directives, DNR, and PULSE, which is a physician-ordered life-sustaining treatment order. Many people in this country die every day receiving care that doesn't align with what they wanted done in their final hours. And palliative care and hospice are ways that those patients who are chronically, seriously, or terminally ill can take control of their care and have a say and be kept as comfortable as possible throughout their illness or during their death. Palliative care is medical care that focuses on providing relief from the symptoms and stress of a chronic, serious, or terminal illness, and it aims to help patients and their families cope with this type of illness and have the highest quality of life possible. The goals of palliative care include providing the maximum amount of relief from symptoms of the illness. It also includes access to meds for pain and symptom management, decreasing hospital admissions, decreasing the stress of having a chronic or serious illness on both the patient and their loved ones, and educating healthcare workers on how to achieve the previously mentioned goals. What exactly is hospice? Hospice is basically end-of-life care that focuses on comfort and quality of life instead of curative measures. With hospice, you're not trying to make the patient better. You're trying to ease their discomfort. You're trying to make their death as dignified and as painless as possible. The goals of hospice are to provide death with dignity, maintain maximal comfort, minimize pain and anxiety, and meeting spiritual, psychological, and comfort needs of the patient and their family. You can receive hospice services in the hospital, at a nursing home, at assisted living, in your home, in an inpatient hospice facility, basically anywhere a person calls home. I mentioned advanced directives in this presentation because with palliative care and hospice care patients, it's important that they have some type of advanced directive in place. Advanced directives are basically legally binding documents that enable you to ensure medical decisions regarding your medical care are aligned with your wishes. So if you are unable to make the decisions yourself, they can be known. And advanced directives are only applicable if you are unconscious, dying, and or in need of an emergency treatment to keep you alive and you are unable to make the decisions yourself. And there are really two main advanced directives: the living will, which is a legal document that is drafted and it explicitly states what your wishes are upon your critical illness and or death, and a durable power of attorney for healthcare, which is a document that appoints an adult as your healthcare representative. They're basically allowed to make all decisions regarding your health and your care in your stead when you're unable to. And some adjuncts to advanced directives that are really applicable to palliative care and hospice are a do not resuscitate order, which is an order stating that you do not want heroic measures to be done. Should your heart stop or you should stop breathing, you don't want them restarted. And that's really applicable to hospice patients, because if you're saying that you don't want any further care, you just want comfort measures, it's kind of counterintuitive to get CPR, for example. And a physician order for life-sustaining treatment or pulse is really something that's targeted for chronically or seriously ill people, such as those who are prime candidates for palliative care. It states the type of treatment that they want and the things that they absolutely do not want. And a pulse is just very ideal for palliative care patients. If you would like more information on palliative care and or hospice, please follow the link below. It is a link to a government website that lists everything about palliative care and hospice care. It lists companies that provide these services, and it mentions the information talked about in this PowerPoint presentation and elaborates even further on it. So please follow this link if you need any more assistance. Thank you for watching this presentation. Please take the post test at this time to assess how much knowledge you gained from this presentation.